Renal pathology, renal artery stenosis. All right, so for renal artery stenosis, this is a renal vascular problem, a renal vascular disease. And there's two types that can lead to this. But overall, we have to understand what renal artery stenosis could potentially mean for the rest of our body. If we have renal artery stenosis, it leads to a decrease in renal perfusion. And what did we say? Whenever we have a decrease in renal perfusion, we have an activation of the RAS system. So we see an overall increase in renin, an increase in angiotensin, and we have an overall potential risk for causing hypertension. Okay? Now, this is the most common cause of secondary hypertension in adults, okay, is our renal artery stenosis. So let's take a look at the two main causes that we have to know that can lead to renal artery stenosis. The first one is atherosclerotic plaques. So as we said, patients with atherosclerosis, okay, it causes essentially a blockage within the tunica intima of arteries. So if we have atherosclerotic plaques within the tunica intima of the renal arteries, it leads to an overall decrease in renal perfusion, okay, and then that can cause hypertension later on down the road by activating the RAS system. Now, what you have to know is that the patient's presentation is very key because it's going to be usually an older male or older female, but usually older male that is a smoker, because smokers and male sex is an increased risk of atherosclerotic plaques, okay? Second cause of renal artery stenosis is fibromuscular dysplasia. For fibromuscular dysplasia, it's going to be a completely separate issue, okay? It's going to be usually a young female with renal artery stenosis, and they're going to have that bead on the beads, okay, of the renal artery, the beating of the renal artery, okay? So make sure you know the difference between that. Now, you're going to hear abdominal bruits, okay, when you do auscultation of that area, okay, which is an important factor. And if you see that, then you know that's occurring. Now, overall, what's occurring is that we're going to have an increase in renin released from the JGA cells and renal artery stenosis, and you get hyperplasia of those smooth muscle cells at the JGA in the afferent arterioles. We already discussed this because they're going to be used more often due to the fact that we have a blockage in that area leading to a decrease in perfusion, okay? Now, the unaffected kidney undergoes increased sodium excretion because if you think about it, if it's a unilateral renal artery stenosis, the other kidney feels like there's so much perfusion, right? Because the affected kidney is going to activate RAS because it senses that there's low perfusion. However, the unaffected kidney doesn't have the atherosclerotic plaque or fibromuscular dysplasia, so it's not going to have a decrease in perfusion. It's going to have an overall increase in perfusion because the affected kidney is running the RAS system. So the one kidney that's not affected is actually going to become larger because it's working harder, okay? Very important. So you're going to have increased renin in the affected kidney, but a decrease in renin in the unaffected kidney. Lastly, for bilateral renal artery stenosis, patients can have a sudden rise in creatinine levels after starting an ACE inhibitor or an ARB. Now, the reason behind that is why? Well, we discussed that ACEs and ARBs cause a vasoconstriction or vasodilation of the efferent arteriole. It's a vasodilation of the efferent arteriole, right? And so that leads to an overall drop in your GFR, okay? So that's why we can have a bump in our creatinine levels because the patient's already at a bilateral renal artery stenosis. So the patient's already struggling baseline with their GFR. If I give them an ACE or an ARB, I'm going to make it worse because I'm dilating the efferent arteriole, further decreasing their GFR, and then that's going to cause an increase in their creatinine, okay? Overall, important concept to understand. I hope it was relatively easy.